As an ophthalmologist, there are situations where you cannot diagnose or treat a case just because you don't have the right instruments in hand. To overcome this challenge, we have brought to you the SMARTSCOPE kit, a must for every ophthalmologist. A kit which consists of every small tool needed for diagnosis from anterior to posterior segment with the help of a smartphone. For examination of the visual acuity, we have a smartphone-based Snellen chart which can be downloaded from the Play Store or the App Store. We have a trial frame with a occluder and a pinhole and also a +10 diopter lens. Hence, we can have a preliminary examination of visual acuity of patients with these instruments. Next range of instruments are for investigations. As you see, the most important is the torch. The next is a BP apparatus, a pulse oximeter, a syringe and a cannula to check duct patency, a glucometer, dilating and anesthetic drops, hand sanitizer and wipes, fluorescent strips for corneal pathologies, forceps and sterile 26 gauge needle for foreign body removal. We also have sterile histopad slides and spatula for corneal scraping, sterile gloves for safe examination. Now we move on to the range of anti-segment examination tools. The first is the eye verter for lid diversion and examining superior tarsal conjunctiva, the ASPE or the anterior segment photography using intraocular lens for smartphone based anterior segment examination, Schiot's tonometry for IOP measurement, and ASPE Gonu for examination of angle structures. We also have IOLScope, a IOL based microscope for smartphone based detection of fungi and parasites. Posterior segment examination tool include the Trace to Treasure RedCam for fundus examination using dilating drops. This kit comprises of frugal do-it-yourself tools required for basic examination of patient from anterior to posterior segment. It is smartphone based and helps us in storing images, videos, helps us in teleophthalmology for expert opinion and for resident learning and teaching. It is easily portable, it's a do-it-yourself, cost-effective, universal kit which can be used in peripheral centers, local clinics devoid of expensive equipments. Also, it's ideal for examination of patient in outreach camps.
Thank you, Dr. Prithvi. Dr. Arshad, sir.
Yeah. Dr. Prithvi,
Yes.
I would just like to add, you can also incorporate an Amsler grid chart.
Yes, sir.
That is something which is...
Yeah, actually, the smartphone application which we have...
Maybe, because that is what, otherwise
it's
you
already
can even
there
have
in
a
that.
paper.
Yeah.
So that would be an additional.
Yes.
And otherwise, just like what the oral lab people have, if you plan, we can have it in the form of a kit, which could be marketed, and that would come in handy because it won't cost more than 1,000 rupees.
Yeah, it doesn't.
Yeah. So thank you very much.